Okay, so I did my recommendation presentation and paper on non-pharmacological therapy for children with ADHD. My name is Sydney Fail, and I did my topic on ADHD and how children are commonly misdiagnosed and mistreated. This is a topic I chose because it's something that really interested me. It's something that I knew a lot about, but I also saw a lot of questions about, so I thought this was a good chance to educate myself. And I also have a brother who has ADHD, so it's something that I grew up with and I was familiar with. So, attention deficit hyperactivity disorder is the most common behavioral disorder in children, and the currency continues to go up. At this time, there's no fully understood etiology, but there is a genetic and a neurological factor that plays into the diagnosis. There are three main types of ADHD. There's predominantly inattentive, predominantly hyperactive impulsive, and a combination of the two. So these children with ADHD tend to have a hard time with like social skills and transitioning and remaining quiet, stuff like that. So the problem is that ADHD is widely misdiagnosed and mistreated. A statistic from one of my sources shared that in a study of 50 pediatric practices, only half of clinicians said they followed diagnostic guidelines to determine symptom criteria from at least two sources and across two settings, yet nearly all reported immediately prescribing medication for treatment. So if only 50% are following the guidelines appropriately, that leaves about 50% of them who could be misdiagnosing children. This is also bad because the recommendations state that behavioral therapy would be the first treatment, not medication, like this statistic seems to have a lot of. Also, the requirements by a diagnostic and statistical manual of mental disorders states that there needs to be a continuing pattern of either inattention, hyperactivity, impulsivity, or a combination of both. So for this, it's important because children are naturally full of energy. So just because a child is full of energy and not really listening too well doesn't mean they have ADHD. Okay, so this picture is one that I really like a lot. It shows, I'll move this up. It says for ages 4 to 5, but really for children in general. It shows like where we've been, where we need to be, and how we can get there. So it shows where we've been is that children with ADHD are not getting behavioral therapy, and that a fourth of them are on medication. And where we need to be is that behavioral therapy needs to be the first intervention. And then what we can do is parents can be advocates for their children and know what their children should be having and how their assessments should go. And then doctors should already have maybe a list of behavioral therapists they have on hand that they send their patients to, knowing that that is the recommendation. So the cause and effect is, the cause is improper treatment due to improper diagnosis. The healthcare providers not using the proper assessments and observation tools to confirm ADHD is an issue. And then the effect is children are being medicated too young, and these families are missing out on behavioral therapy, which could show the benefits of social skills, motor skills, relationship skills, and much more. So the solution is advocating for children to have this behavioral therapy. It's really important for them. According to the U.S. Centers for Disease and Control, the first treatment for children with ADHD should be behavioral therapy. Some guidelines that parents should be familiar with when their child is going to get assessed is that there are many different assessment tools and scales. So assessment tools and scales should be in two different settings. Home and school is normally the normal. And that the symptoms should be seen by two different people, someone maybe at home, someone at school, in different settings, because the children can act differently in two different settings, just like everyone can. And that there also needs to be a minimum of 6 to 9 symptoms shown. This is important because just a couple instances of not listening or being hyper doesn't really mean they have ADHD. Okay. The other important thing is to recognize that comorbidities are common with ADHD, and behavioral therapy can help both the comorbidity, whatever it may be, and the ADHD at the same time. So some of those possible comorbidities include anxiety, OCD, depression, so it's really important that these are also recognized. This video here is a good explanation of behavioral therapy for ADHD, and it talks from a couple different sources like CHAD, which is the Children and Adults with ADHD, and the National Institute for Mental Health about why behavioral therapy is so important.
Let's talk about behavioral treatments for kids with ADHD. There are two kinds of behavioral interventions that can help children with ADHD manage their symptoms of hyperactivity, impulsiveness, and inattention. Parenting skills training, or behavioral parent management training, teaches parents to give immediate and positive feedback for behaviors they want to encourage and ignore or redirect behaviors that they want to discourage. They may also learn to structure situations in ways that support desired behavior. Learning stress management techniques can benefit parents of children with ADHD by increasing their ability to deal with frustration so that they can respond calmly to their child's behavior. Now, skills-based training teaches children techniques they can use to stay on top of their schoolwork and manage their responsibilities at home. This kind of training, which is done by learning specialists, teaches kids skills to maximize their strengths and compensate for their weaknesses. For example, children who have trouble finishing things and staying organized can learn techniques for completing tasks, keeping track of assignments, and getting their schoolwork done. These ADHD therapies don't affect the core symptoms, but they teach children skills they can use to control them. Some focus on strategies for staying organized and focused, and others aim at cutting down on the disruptive behaviors that can get these children into trouble at school, make it difficult for them to make friends, and turn family life into a combat zone. Some children, especially those with severe ADHD symptoms, benefit from behavioral therapy along with medication. For others, the training may make enough of a difference to enable them to succeed in school and function well at home without medication. Now, one important reason for kids to participate in behavioral therapy, whether or not they also take medication, is that ADHD medications stop working when you stop taking them, while behavioral therapy can teach children skills that will continue to benefit them as they grow up.
That last point is super important for why behavioral therapy is so important for these children. So my research process, pretty much I got a lot of my sources from Google Scholar, especially these sources right here were my most used ones. They were very helpful. These sources were visited countless times to make sure I got the best and most useful information for my project. And then these are my sources. I can move this. Perfect.